Nice to see you again. I wanted to share with you guys tonight about how to stay healthy and to stay strong through the whole pandemic, the last 6 weeks of research trying to figure out everything that's going on. It goes back to the basics. That's how we fight this virus, is to stay healthy. It's our only way. There's no particular drugs that are going to help. There's no vaccine as of yet. And so staying healthy is our only option right now. And even if you think you have had COVID or you know you got tested positive, Korea just announced this week that people are getting it for the second time. So the virus is actually staying in people and resurging at an opportune time. And the goal is to stay healthy so you don't actually give the virus an opportunity to get strong in the body. And so the first thing to do to stay healthy is to drink 32 ounces of warm lemon water. Well, and I should say hot. Actually, the virus is a wimp when it comes to heat. So the hotter the water, the better. And a little pinch of cayenne pepper, too. Will spice it up, make it hot, and help actually with circulation in the body. With the 32 ounces of hot water, about a half of a lemon will do. And this helps if there's anything sitting in the mouth or in the throat to flush it down, get it into the stomach so that it can get out of the body. The stomach acid will actually help kill the virus. Also, if you start this first thing in the morning, it will help cleanse and flush out all the toxins that were released from the night before. And I've actually had sensitive patients detox too fast from the lemon water. So I actually tell them not to add the lemon, not to add the cayenne, and just do the hot water. And that's enough of a detox. And so if the coronavirus is not in the mouth or the throat, but actually in the sinuses, the hot water won't help, but a hair dryer will. I literally, every time I come home, spend about 6 minutes using the hair dryer on low heat, if hot heat is just too hot. And you aim it like at 45-degree angles in more into the nostrils, because I'm thinking if you really breathed it in, and now everyone is wearing masks, which is very helpful. Hi, Mom. And so the heat will kill the virus, and about 6 minutes will do it. And just breathe slowly. If the face gets hot, then you would just spray your face with a water bottle. It keeps it cool. To keep the immune system strong in general, that's what I do for a living, is make personalized supplement programs. But if you want to know in general what I'm using in the office, is vitamin D, basic. Everyone should be on it from the winter anyways. But instead of a supplement, what's even better is if you actually can go outside safely and get 10 minutes, the more skin you can show, the better. As it gets warmer in the Northeast, that will help. So vitamin D, either a supplement or sunbathe 10 minutes every day. Vitamin C is really good. Not any vitamin C. Either it comes from food, the supplement is food-based, or liposomal vitamin C are the best. Zinc, either tablets or lozenges, are a great immune booster. I like the lozenges, especially if the virus is in the mouth or the throat. The lozenge sits there and gets absorbed, and if the virus comes in, it gets killed right away with the zinc. However, a lot of lozenges have added sugar in it, and that I don't like. So sometimes I'll do the zinc tablets. So it depends on the person. And what else? Oh, lastly, what I end up giving a lot of patients is Wellness Blend, which actually is my personal formula, the supplement that I developed in 2018 because people were getting sick and coming to my office, and for everything that they needed, they were walking away with 4 or 5 different supplements to get their immune system nice and strong, and sometimes it was just too much. So I created Wellness Blend to kill everything. It has garlic, kaolic garlic, liposomal vitamin C, mugwort, echinacea, oregano, lysine, eucalyptus, beta glucan, and golden seal. I'll go through and I'll explain all these different herbs because I think it's really important for you guys to know. This is how you take your health into your own hands. So in China is actually where they started using IV vitamin C to actually treat coronavirus patients. And 2 weeks ago, New York City started using it as well. I was so grateful when I heard. Specifically, Dr. Andrew Weber, a pulmonologist in New York City, specifically started using IV vitamin C, 1,500 milligrams several times a day. It's just now part of the antiviral protocol for them, and I'm so grateful. If you were doing a vitamin C supplement, and most of what's on the shelf is ascorbic acid, which actually the body has a really hard time absorbing. It's chemically synthesized in the lab using cornstarch and lots of acids. So it's not something that the body knows as that it's good for it. If it comes from a food source, the body recognizes food, its replacement parts. A lot of the times you take a vitamin C ascorbic acid and your urine is bright yellow, and that's because of all the vitamin C the body didn't know how to absorb. So vitamin C, if you liposomal or plant-based is the way to go, but also increase it in your diets. Citrus fruit, oranges, grapefruits, lemons, kiwi, strawberries. It's actually in red and green bell peppers too, and tomatoes. Oh, and it's also in cruciferous vegetables, broccoli, cauliflower, Brussels sprouts. And so just try to eat more of all of that if you can. And I put the liposomal vitamin C in the wellness blend. The liposomal is a certain technology that allows the vitamin C to be absorbed using phospholipids. In this one, it uses sunflower to help carry it and protect and deliver the vitamin C into the body. Now, garlic is known to kill everything, and it really does. It kills the parasites, kills viruses, bacteria, and fungus. And the kaolic garlic in particular actually is aged and loses its odor and the harshness that sometimes people feel when they take a garlic supplement. So you can use kaolic garlic on its own or in the supplement. And so you can also cook with garlic. Raw, if you're going to use it medicinally, is the way to go. It really loses its medicinal value if you cook it. Within 60 seconds in the microwave, all the medicinal value is gone. You shouldn't really be using the microwave anyways. And then about 45 minutes in the oven and it starts to lose its properties. But if you crush or slice the garlic before you cook with it, wait 10 minutes and that will help it keep its medicinal values. And the more garlic you cook with, obviously, the better. If you can do more than a clove in a meal, great. I use mugwort in Wellness Blend because mugwort, actually, it's a Chinese herb. Its added value is not with the immune system, but it is a liver tonic. It really helps cleanse the liver. And if the liver is less toxic, toxins won't build up. And that obviously, the more detoxed your body is, the healthier your body is. Now, echinacea not only supports the immune system, it actually has been proven to reduce severity and duration of viral infections in particular. Oregano, I use, it's a very good antibacterial. It also supports the lungs in particular. It's good for any illness that has a cough. Oh, can you guys see me? Okay, I guess, can someone type something? Because I don't know if you can actually see me. It says trouble playing video. Okay, okay, okay. So I can't see myself. So I apologize if my eye contact is now off. Hopefully it comes back on. Okay. Thank you guys. Um, and so, okay, oregano, good for anything that has to do with the lungs. Hi, Jason. Good. Okay, you guys are there. And so, um, oregano is really good for the lungs. Anything with a cough, bronchitis, asthma, patients really do well with oregano. Lysine is an amino acid, it's antiviral. It works to increase the number of antibodies in the body. The more antibodies you have, the stronger your immune system is. And studies have shown that vitamin C and lysine actually together increase antibodies and boost up the immune system even more. Eucalyptus oil is a cure-all for the lungs, it's particularly removing any type of mucus or phlegm and the sinuses. It's good at killing bacteria and candida in particular. Now, beta glucan is different. It's a soluble fiber. It boosts the immune system, and it's also good at lowering cholesterol and helping with blood sugar management, which is needed for anybody with diabetes or pre-diabetic situations. Golden seal is one of my favorites for the common cold, also for the stuffy nose and respiratory system. It's actually really anti-parasitic and can help with any type of digestive issues, stomach pain, ulcers, diarrhea, constipation. And so that explains the wellness blend and why I love it so much. So preventatively, if you have children and they can't swallow a pill, and in fact, I have some adults who actually can't swallow pills, I use a homeopathic remedy from HVS Laboratories called viruses. And it's good as a preventative and even for infants, because a lot of times people are asking me, what can I give my baby? And so I even 3 months old, this would do the trick. If you have a 2-year-old, if you have a 2-year-old or younger, half a cap a day. On anybody older or adults, a cap a day would be enough for preventative. And so if you actually feel like you're getting symptoms and you think you might have COVID, the supplements would totally be different. Actually, fighting the virus is different than preventative. And so I want you guys to know that. But both preventatively and if you were going to fight the virus, eat as much garlic and ginger as you possibly can. And I have an immune boosting tonic that I absolutely love. I've been using it for about 5 years now, usually just in the winter. But it uses garlic, ginger, lemon, and honey. And anybody can take it. 1 teaspoon a day. It also helps with digestion and promotes detox. What you would do is you would take 2 lemons with the skin and just chop it up into large chunks. A half a cup of fresh ginger peeled into large chunks. A half a cup of garlic cloves peeled. And a half a cup of raw Manuka honey. Now, Manuka honey is very specific. It's very medicinal, and it comes labeled with numbers, +5, +10, +15, etc. The higher the number, the more medicinal it is, but also the more expensive it is. But trust me, it's worth it. So whatever the higher number you can find, buy it. You put all the ingredients in a blender, you pulse it, and it comes a paste. And so it's easy to scoop up, and you would do a teaspoon a day, just preventatively. The more you use it, the more it builds up in the system. So the more frequent you use it, the better. If you actually feel like you're getting sick, you can do a teaspoon every 3 to 4 hours, and it's really helpful. Store it in a glass sealable container in the refrigerator, and the older it is, actually, the stronger it gets. And I like having the skin on it. I like having the paste because the skin is fiber, and that fiber actually is needed. It's good for the gut. It helps with bowel movements, but it also helps the good bacteria grow, which we all need good gut flora. And it's also best to take before meals. Empty stomach, either I do mine first thing in the morning, after my 32 ounces of water, or right before going to bed, or at least a half hour before meals. Okay, let's see. Um, I love essential oils. That would be another thing I would use either preventatively or if you were fighting COVID. I muscle test the essential oils as well. There's lots of good immune boosting ones, but if I was going to give a general good one that just beats everything, you would buy the empty vegetable capsules online, and you would actually do your drops of essential oil in the veggie capsule and then take it. I would do daily 2 drops of frankincense, 2 drops of tea tree oil, 4 drops of On Guard. On Guard is a particular clove blend. I like doTERRA. They make this On Guard blend. doTERRA just seems to be the best brand out there. I know we all have ones that we really like, but that's the one I use. 2 drops of oregano, 4 and 6 drops of lemon. And then just put all the drops into the capsule, but be ready to take it because as soon as you start putting the oils in, the capsule actually starts disintegrating. And so I take it with food, so I do it right after breakfast. And so as I'm talking about all the great things that you guys can do, I want to also talk about the things you shouldn't do. And the number one thing that is the worst thing to lower the immune system is white refined sugar. Your cakes, your cookies, your candy, your quarantine snacking. We really need to change that. It's not that the sugar actually feeds the virus. Viruses actually don't eat. They don't metabolize anything. They're literally bits of RNA, DNA, protein in a shell that just run around your system. They attach onto your cells, and then they go into the cell and they make the cell replicate the virus until the cell gets bigger and bigger and bursts. And at this point, there's like thousands of viruses in that one cell. And then all the viruses, go on and attach to other cells. What the sugar does is it allows the virus to attach to the cell easier. And we don't want to do that. The other things, and when I talk about sugar, I really am talking about the white refined sugar. In moderation, we can do real maple syrup, we can do honey, we can do coconut sugar. I love to bake with coconut sugar. And some organic cane sugar, limited amounts for healthy people would be fine. And as if sugar wasn't hard enough, you're not going to like the next thing I say, which is really try to limit the alcohol to 0 if you can. And if you do have it, drink lots of water, just flush it out of your system because it's a depressant. It lowers not only your mental cognition, but also the immune system. And smoking, which, should be obvious. This, virus attacks the lungs, but at the same time, you need to quit now. If you're not going to do it for a pandemic, for a virus that, goes after the lungs, I don't know when you're going to do it. You have the best chance if you make your lungs healthy. Okay. So that's my lecture. That's my negative lecture. To go back to the things that help is a really good night's sleep. Again, I told you guys this was all about going back to the basics. And if you're having trouble sleeping, actually the same time every night helps, and the body starts getting into that circadian rhythm. Even on the weekends, you guys aren't going out. If you can keep it the same time every night, that would be great. And if you actually can do no electronics 30 minutes before bed, I've seen it really help people get into that REM sleep better. No electronics, no TV, no iPad, nothing, no phone. And so that 30 minutes, oh my goodness, what are we going to do? Meditate. It really helps me. Take a bath. Read a good book. If you're not into meditation, it's just like too quiet. Visualization, just get one on YouTube, can really help. If you listen to someone's voice, it kind of gets you out of your head, out of your own thinking. And that can be really helpful to relax the body. And as a chiropractor, I need to tell you guys that spinal adjustments really help open up the body. Not all of you guys are, coming out to get adjusted, but as soon as it makes sense to go, it would really help to get the spine in alignment, get the nerves flowing properly to the organs. And I didn't know this until recently with all my research, but in the 1918 with the Spanish influenza, in New York City, reports show that with every 10,000 cases treated medically with drugs, 950 died. But without drugs, with chiropractic and other alternative modalities, only 25 patients died of the influenza out of every 10,000 cases. That difference is 950 medically treated and 25 not medically treated. I couldn't believe the numbers, but I really wanted to show you guys what a difference that makes. Now, exercise is definitely important. It really helps boost up the immune system. It's a great stress reducer, and go out for long walks or runs if you can safely. And now there's tons of online classes. So please put that into your daily routine. You should be doing it at least 5 days a week, if not more. And it helps also exercise the lungs, do that cardio, get the heart pumping. And I never thought of actually exercising an organ before the pandemic. And with all the pulmonologists going out, talking about how important it is, breathing exercises is what I want to talk about next. And so on a daily basis, besides cardiovascular exercise, we should be doing some sort of lung exercise. There's a lot online that you can just Google. And what I want you to notice is the diaphragm. When you breathe, take a deep breath. Don't pick up the chest first. Use your diaphragm lower down under the rib cage. You want to push that out first, fill the lungs from the bottom, and then work up. When you use your diaphragm to breathe, this is the only breathing muscle there is. If you're not using this and you're breathing from here, you're using the neck and shoulder muscles to pick up the rib cage. And this is why we get tired. We have neck cramps. We have knots in here. This is where we put our stress, because we're actually not breathing properly. So I want you guys to learn how to use the diaphragm to breathe. And so it also, when it goes up and in and out, and you're using the diaphragm to breathe, it also, the stomach lays right under it. It helps massage it, and it helps with digestion. There's so many good reasons to breathe. And so when you do your breathing exercise, make sure that you're breathing from the diaphragm. And so the more oxygen you can get in per breath, the body can just do so much more with on the molecular level, on the cellular level. Everything gets enhanced, and your energy is better as well, and besides just boosting the immune system. And I actually, doing research, learned about Wim Hof. Recently, a patient told me about him because he was actually doing Wim Hof breathing exercises to help his eczema, which I couldn't believe the results. And it just getting more oxygen in, allowing the oxygen to heal the body. So Wim Hof, you can Google him. He's known as the Iceman because he's been able to control his breathing so well that he's been able to do these amazing things. And he did 112 minutes in sitting in ice cubes to here, just in suspension. And he did a Kilimanjaro, the highest mountain in the world. He climbed it in shorts, and he's ran above the Arctic Circle, a half marathon, which you would think that would be enough, but no, he did it without any shoes on. So that's what you can do if you can control your breath. And I'm not asking any of you guys to run a half marathon in the Arctic, but let's just stay healthy. Let's, have as much oxygen as possible. Really quickly, one of the pulmonologists told me if you just do 5 deep breaths, this is another exercise that's just quick. And then on that 5th breath at the end, you exhale and then you purposely cough. And then that actually pushes any type of congestion that's off. That's actually making sure that the lungs have that deep pressure. And that's important to get stuff to move, especially out of the base of the lungs. And another thing would be to keep the lungs moist. So take, your steamy, hot showers. If you have any type of essential oil, peppermint, eucalyptus, just put it on your hand, smell it, breathe it in, would be really good. Minty toothpaste, just brush your teeth and have that all kind of open up. If you do start actually getting a fever, I wanted to talk about this as well, that because the virus actually is a wimp when it comes to heat, your body produces a fever on purpose. So you actually want to try to keep a fever going. People are too quick to reach for the Tylenol or the Advil, ibuprofen, Motrin. Don't try to get the body to keep the fever so that you can literally burn the virus off. Don't You're allowing the virus to be weaker with the fever. But my 102 is like my cutoff point. 104 really damages the body. So 102, I'm like, okay, if you can stand it, if you can get to 102, fine. Over 102, I would take calcium. I wouldn't even go for the drugs yet. I would take calcium. I would take 3 calcium every 20 minutes until you see the fever go down. If you're up to 12 calcium and there's been no change in the fever, then that's when I would reach for the Tylenol, but only the Tylenol. And because actually research has been showing that the doctors are seeing the people who have the worst cases of COVID have Advil or NSAIDs in their system. So actually purposely don't do any of the NSAIDs. And so once the fever breaks, moving around really helps. So don't stay bedridden. And so these are all my good health tips, which are good for the immune system in general. The only one that's for the coronavirus would really be the hair dryer to heat up the sinuses. And so I wanted to talk to you guys about if we take this time to really get healthy, get strong, the goal would obviously to make this a lifestyle and to keep all of this in place. I mean, I think that's what a pandemic is. It's a global cry for help. And we really can take this opportunity to create a new normal for ourselves and for the world. So one of the things I wanted to ask you guys was, what do you want your new normal to be? What are the changes that you're making now? And in thinking about it, when the world starts opening up and we start going back to normal, that I want you guys to be careful of gaslighting. And I don't know if you guys are used to that term, if you know what that term means, but it's when somebody makes you believe something that isn't true. It's almost like a form of manipulation. Like your friend Dave tells you, no, I don't smoke, I didn't smoke, even though you just saw him smoke an hour ago. And it's that type of behavior. And so I think when I think about it, that's what we're going to just want to go back to such a normalcy. I mean, we all want normal right now, that I want you to be careful of all the marketing that it's just, I can see it. It's just going to hit us hard. It's going to be the usual billboard or, the 100 TV commercials or the new marketing, all the memes. And so just be careful about it. Because I mean, it's almost like we're going to be subconsciously wanting our normal. And of course, but what actually would make us feel good? We think it might be the new iPhone because that's what my daughter wants. That's what she thinks is going to make her happy. Or it might be like trying on the new Nikes that we want, or, finally getting that Venti blonde skim latte. And so be careful, make better choices, and don't give in to all the marketing, but really ask yourself what you want and what we can actually build. It's not been easy. and scrolling down, through your phone in the middle of the night, trying to figure out what is the world coming to. But, and so it's almost like we want that comfort more now than ever. But also, I want you guys to do a paradigm shift and think about all the good things that have happened. My daughter told me earlier today, she's like, Mother Earth had the best Earth Day ever. Because of all the things that are changing with us not being out and polluting it. I thought it was so adorable. And I mean, when I walk down Lexington Avenue in New York City, I can hear birds chirp. I didn't know there were birds in Manhattan. And, all the pictures of a carless LA and the air pollution being, and the blue skies, and coyotes have been seen on the Golden Gate Bridge. Have you guys seen that? I mean, that's real, and it shows that we can do something about it. And I don't know what that's going to look like, but I want you guys to think about it now, and before we get bombarded with trying to go back to normal. Because I mean, it's also shown us, it's the pandemic, the virus, it didn't break us, but it did show us truth, the good truth and the ugly truth. The good truth on that Mother Nature can regenerate. The good truth of every good Facebook post I see, of every time somebody brings food to their neighbor. I mean, that's all good stuff. We're good people. But it's also brought up the truth of you know the consumerism and the government and our healthcare system. We don't have enough organization or system to have our frontliners, our doctors and nurses who are dealing with COVID patients, to even protect themselves. Talk about going back to the basics. It's kind of scary. I mean, we're so confused. The truth is, the ugly truth is that you know billions of people don't know who to talk, or who to listen to for basic health that's going to actually help them survive right now, because there's just too much going on. And so, with this truth revealed, the good, the bad, the ugly, all of it, it actually gives us a chance to rebuild. And I really truly believe that we can do it together, consciously, with awareness. And I guess together is the right word. So, before we start, opening back up, before the gaslighting starts, I want you guys to think about it. So, thank you so much for giving me this time with you. Be well.